Next up, we have our ACE inhibitors, and we can recognize these because of their pril ending. So this is going to be our lisinopril, enalapril, and captopril. Now, these medications work by blocking the conversion of angiotensin 1 to angiotensin 2. Angiotensin 2 is a potent vasoconstrictor. So if we block its effects, we're going to get vasodilation, which is going to decrease vascular resistance and reduce blood pressure. We can think of this like 20 people crammed into a tiny little elevator. If we suddenly open that elevator up into a big conference room, those 20 people are going to have so much more space and they're going to be under a lot less pressure. And that is the role of our vasodilators. So what does the NCLEX expect you to know about this class? Well, if you remember nothing, I want you to remember angioedema. This is a rare but potentially fatal reaction to ACE inhibitors that causes rapid facial swelling around the eyes, the lips, and the tongue. And this is an emergency because all of that swelling can block the airway. So if a client is taking an ACE inhibitor and the NCLEX mentions burning, stinging, or itching in the face area, this is your priority finding. You need to hold that medication, immediately report the symptoms, and prepare to give epinephrine. Next up, we need to remember our dry cough. Now, ACE inhibitors can cause this persistent, dry, hacking cough, but don't let the NCLEX trick you here. This isn't immediately dangerous. If it doesn't go away or it becomes bothersome, the client might be switched to a different medication, but it's not a priority finding that we need to immediately address. Now, it's important to remember that ACE inhibitors can cause hyperkalemia, which means these medications can raise potassium. So if the NCLEX asks you about dietary choices for clients taking ACE inhibitors, look for options that avoid potassium supplements or salt substitutes because these also contain a lot of potassium. And lastly, ACE inhibitors are teratogenic, which means they can harm a developing fetus. So if the NCLEX asks you about who shouldn't be taking these medications, look for the pregnant client.